Welcome to Amplify OT's holiday party, our first holiday party, kind of looking at 2023 in review. So some of the things that we've been able to achieve here with Amplify OT, and then getting into the policy resources and things that have been going on this last year. And I definitely didn't capture all of it because there's always so much going on, but even I was a little surprised by how much has changed just this year. So for Amplify OT, let's see here. So by the numbers, we had 70,000 website visitors this year, which is an increase of 56% from 2022. So some really great growth in terms of folks coming to my website, around 1,300 new Instagram followers, and around 1,300 new email subscribers. We also produced 3 new free resources. A big thank you to Lindsay for helping with those. We have the discharge planning guide, which has been downloaded or signed up for by 463 people. The home health guide, which has 73, so I need to advertise that one a little bit more. And our reimbursement guide, which has 643 signups. So it's great to see that these resources are getting out there to practitioners. So the Amplify OT podcast, I had 20 podcast episodes that were published this year. So that was exciting. I apologize for the last month and a half hiatus, but a podcast episode did come out today, and I'll be back on a normal schedule in January. Things just got too busy. But this year we've had over 4,000 unique listeners and over 8,000 podcast downloads. So the downloads are how many times it gets downloaded to a phone. The most popular episodes this year was episode 28, How to Be Successful in Inpatient Rehab with Courtney the OT. Episode 27, The Role of OT in Acute Care and Challenges of Discharge Planning with Genuinely OT, Alyssa, and How to Choose the Correct CPT Code with Mandy Chamberlain and OT Flourish. So clearly, folks are liking the interviews with other OT practitioners, so I will keep that up and keep that in mind for 2024. I actually have an interview coming out with Vic Patton, he's on the current AOTA board and he's running for president, and that'll come out the 3rd or 4th week of January, somewhere in there. So stay tuned for that one. For articles this year, we had 12 articles published. The most popular articles continue to be Everything You Need to Know About Section GG. That's actually one of my very first articles that I published, and Google picked it right up. And so I get a lot of visits. I think I've had 15,000 visits to that article this year. How to Bill OT under Medicare Part B is the second most popular, and Reimbursement Models in OT, Do You Know What They Are? And that's one of our 3rd most popular articles. So excited to have, I'm surprised that we got 12 articles published. Lindsay, I don't know if you're surprised by that too, but I do actually have a plan next year. Lindsay has written about 6 articles that are in draft form that I need to edit. So those will be coming out on point of service documentation, the False Claims Act, and we're doing a better job of making sure that content is streamlined together for 2024. So trying to get some things organized. Okay, resources. What have we created? So we created 1 new fieldwork planner and guide that is up there on the top right. So we're really excited about this product. It's a level 2 fieldwork planner. So this one is for occupational therapists. The one for OTAs is just about ready to come out. It's about 100 pages. It includes monthly and weekly layouts. It also includes resource pages and mental health prompts as you go through your level 2. So it encourages you to reflect on each week, what you've learned, what you liked about it, and what you can improve for the next week. So trying to support both those elements of just kind of planning and getting through a complex experience, and then also doing some of that supporting of mental health and journaling through our fieldwork planner. And we'll also work on getting a capstone one produced. So that one's currently in the works. We have 8 new OT amplifier designs. So very exciting to roll out our diverse OT amplifier series. So these are the designs below. This is certainly not the limit of designs that we'll plan to produce, but this is where we started. We had 3 new OT amplifier products. We have notebooks, which are in all these different designs available on Amazon. Merch, which are the t-shirts, those are available on Amazon as well in all the different designs. Stickers, and those are only available on my shop. And then we also have new Amplify OT t-shirts, which you can see here. And Lindsay is modeling that tonight. So all of these products, except for the stickers, are available on Amazon. I have links to them on my website. So it's really also been exciting to kind of see that area grow and be able to kind of just support some fun products and for folks to be able to show off their OT amplifier pride. All right. So the Amplify OT membership, it's crazy that I've only had it for a year now. So it launched in January of 2023. We welcomed approximately 100 individual members, so practitioners largely. We welcomed 380 student and faculty members, and we fully re-recorded the Mastering OT Policy and Medicare course, which we introduced new accessibility features like closed captioning and transcripts available in both regular font and dyslexia-friendly font. Fully edited transcripts and over 6 hours of content, and we have more to come. Lindsay and I both have an extensive list of additional lessons that we want to add, and most likely we'll be putting in a 6th module that will cover things like productivity and maybe some documentation, kind of the policy adjacent topics that are still really influential in our practice. So very proud of the progress we made with the Amplify OT membership, and I'm going to be doing a special kind of 1-year launch, I think, in January as we plan something up. I say in January, but that's like 2 weeks, 1 week away, so we'll see how we get there. Also very excited about the Amplify OT membership student edition. So we created a comprehensive faculty guide to accompany the course for universities enrolled in our membership. This is a over 200-page document that includes all of our handouts and assignments. We aligned the lessons with ACODE standards, developed assignment outlines, and we improved user experiences by just having new pages and better flow. So this was very exciting. And what's most exciting is that we have 10 universities that are now going to be enrolled. So 3 or 4 of these I'm onboarding in January, but they've already agreed to continue with Amplify OT. And so these are universities that have decided to use the Amplify OT membership as part of their curriculum and their program. So I'm very excited. Last year I had 2, so to grow to 10 this year was just really fantastic. And my goal next year is to get up to 24. So we'll see. So if you know a friend, let them know and see if we can meet that goal next year. We also had our first expo booth. This is a huge accomplishment. I had no idea if we'd be able to achieve it. This was something in January that I said I'd really like to be able to do, but didn't know if we'd be able to afford it. So the first expo booth at the AOTA Education Summit in Denver, Colorado. There's Lindsay and I there. So glad that Lindsay came with me because our booth was popping. There were people there constantly throughout the conference, and cannot wait because next year is in Charlotte, so just a couple hours from me, so it'll be even more perfect. So we'll have a booth next year as well. No booth at AOTA though. The booths at AOTA are incredibly expensive. And as I learned, you have to purchase all of your different items like separately for the AOTA booth. So if you want a table, you have to buy the table separately. And, I just don't have table money right now for the AOTA booth, but that's okay. So at the Ed Summit, we're very excited. You can see we were definitely one of the most colorful booths there with all of our different colors, and people loved you can see the notebooks are down there, our fieldwork guide and our faculty guide. So it was a really great experience. All right, let's see, is that the last thing? Okay, so here's what's coming for Amplify OT in 2024. Some of the things. So I'm making a 2024 Medicare updates course. This one may end up being slightly delayed. So every January, I come out with a new Medicare updates course, kind of going over what's changed and what's changing in 2024. But we most likely will not see any significant policy pass until sometime in January. So the new course may not come out until February, depending on what happens in Congress. Also going to be introducing Medicare Mondays. So every Monday, I am going to do my best to post a question on social media in the Amplify OT membership, and then I'll be recording a video answering the question and make that exclusively available in the Amplify OT membership. We'll also have monthly advocacy video updates. So that's another goal of mine. I produced one in March and then never did it again. So another goal is that I'm going to be doing kind of like 5-minute news type updates at the beginning of each month, kind of recapping what's gone on. The OTA Fieldwork Planner is coming out. The Capstone Planner and Guide will also be coming out later in 2024, and also hoping to introduce live labs and classes for practitioners and students. And as if we didn't have enough going on, I'm super excited to announce the Amplify OT app. So this has been another big goal. To be able to roll out an app where it's easier to access Amplify OT resources. This will be free on Apple App Store and the Google Play Store. There's also now a new free tier of the Amplify OT membership. So previously it was only accessible to paid members, but there is now a free level of Amplify OT. So if you go and just try and sign up, you're able to do that. You access 3 courses for free. So I included a couple of my regular courses in the 2022 Medicare update course. You get access to updates posted that will be on the app, and then you'll be able to participate in my new OT Amplifiers community group. So very excited for this. It is almost done. There's a couple bugs that still exist, so it's currently going through tech support, and then once that's done, it'll be sent to Apple and to Google to approve the app. So hopefully it'll come out in the first quarter. Ideally, I'd like to see it in February, but you never know. So it's kind of up to how quickly they decide to approve my app. And last but not least, I am so excited to announce the Amplify Therapy Summit. So this is coming in July of 2024, something that I've really wanted to do. It'll be 100% virtual. It'll have live and asynchronous content, and there will be a free option as well as an all-access pass. So some of the materials will be available for free to individuals, and then there will also be upgraded opportunities to attend different sessions. So we are seeking speakers and sponsors, and this is the website, the Amplify Therapy Summit. So you can already go to that website right now and get on the wait list for when the summit opens. And this is the beautiful logo for the Amplify Therapy Summit. So I'm very excited. It'll most likely be kind of like a week long is what I'm thinking. So we'll kind of drip content throughout the week and then have some live panels and Q&As and those sorts of things. So really planning for this to be an opportunity to discuss policy, try and problem solve around policy, and really kind of discuss what's going on, how it's impacting practice, how we feel about it, and see if we can't kind of come up with some policy-centric solutions together as a community. Ideally, I would love to see the Amplify Therapy Summit grow into something that has all 3 disciplines, but we're going to start with something reasonable for this year, and start with just OT. So I'm very excited to see this come together, and it is purposeful that it's in July. It's kind of a good time before state conferences pick back up in the fall, and also all of the Medicare policy kind of comes out by the beginning of July. So we'll already have the inpatient, rehab, and the SNF proposed rule, and maybe even the final rule. And then we will have the Medicare physician fee schedule and the home health proposed rule. So we'll be able to talk about all those different things towards the end of July. So stay tuned for that. I'm so excited. Okay. So thank you. I have to put in some thank you slides. I want to thank all of you who are here and anyone who's listening to this recording. Obviously, want to thank my husband who makes sure that I keep going. Lindsay, who's my project assistant, who's here, and also the one who makes sure that my ideas help come to life. Lindsay has received a number of voice memos, text messages that say, hey, I have this idea. Can you save it somewhere? And she's very good at keeping track of it. And then we go through the list and say, and prioritize and make sure that things happen. So she is essential to Amplify OT. To Nadia, who's my virtual assistant, she helps keep things running smoothly and makes beautiful web pages. Jessica Stanton is my podcast editor extraordinaire. So I record the podcast and I'm able just to hand it off to her, and she's what makes it sound so good. My Defying Gravity Mastermind, which is 6 wonderful OT practitioners who are entrepreneurs. So I meet with Maria from Toilet Talk, from Mandy from OT Flourish, Jenny from Jenny Gill Copywriting, Cheryl from Arthritis Life, and Lindsay from Equip Me OT. So we meet every month to encourage and inspire each other. So they're a huge part of this. Melissa Lapointe is my business coach. So I definitely have learned a lot from her and developed strategy. And of course, all the other amazing OT entrepreneurs and influencers who help keep me sane and message me and send me emails and tell me all the different things that I, need to do, and also just encouragement. I also have a special thank you to Raffi Wagner, who's always gives me a lot of feedback. She's an Amplify OT member, and did a podcast with me earlier in the year that's really fantastic on some kind of ethical dilemmas and issues around licensure. Lauren Burns, who's part of our membership, Jennifer Dowds, Gail for being here and supporting, always providing me with feedback and always providing some editorial feedback as well, which is much appreciated for someone who's a terrible speller like I am. Jesse Bricker, Amy Stark, Michelle Jackson, Courtney and Alyssa for being on the podcast, Taylor Cozy, And then, of course, my app testers, so folks who've been kind of testing out the app before it's launched, which is Raffi again, Madison Wilson, who tested it while on her honeymoon, I might add. So that's commitment. I told her it was not necessary to do that, but I really appreciated it, Jenny Gill, Carrie Miller, and Victoria. So thank you to whenever you see stories and respond to them or help me out. I really appreciate it because legitimately I cannot do it without a community. So it's been a year. It's exciting. Now I have the advocacy updates, which may have been the real reason that you decided to attend, and that's okay. So for what happened in 2023. So we had some interesting policy stuff happen, right? We started the 118th Congress in January, which means we had a fresh slate on legislation. So all the legislation from the previous Congress disappeared and it was time to start over. So that first year of Congress, we always kind of expect delays and issues in terms of kind of getting legislation introduced and passed because it just takes a while. The COVID-19 public health emergency ended on May 11th of 2023, which that feels like 6 years ago, I feel like at this point. So it's wild to believe that it was only like barely, 6-7 months ago. Kevin McCarthy became the first Speaker of the House to be removed through a motion to vacate. So we not only made U.S. history this year, and then we had a 21-day hiatus in the House as they battled to find a new Speaker. So the House was unable to progress or move anything for 21 days, and that really kind of slowed things down as well. And obviously this has taken up a lot of oxygen in Congress and made it very difficult to get anything else passed and through. So our advocacy wins, right? Always good to start with these. Cuts were delayed for home health. So there was a slight increase provided. If you ask home health providers, it was still a cut. And technically, yes, it was when you account for inflation, but they were proposing additional cuts. So Medicare actually provided a slight increase in funding to home health, which was great. We removed Section G. I say we, it wasn't me. They removed Section G from the MDS, which reduced duplicative paperwork. So we still have Section GG on the MDS and SNF, but Section G has been removed. With some of those elements incorporated into Section GG, which will be interesting to see if we see those other elements pop up in our other settings. We'll see. We had the successful inclusion of caregiver codes in the calendar year 2024 Medicare physician fee schedule. I cannot emphasize enough how big of a win that this is. AOTA played a huge role in getting these caregiver codes passed, and then it's amazing how quickly they were able to convince CMS that it was worth spending money on a service where the patient is not present. So these are the very first services that we will be able to get reimbursed for when the patient is not directly receiving care from us, when we are working only directly with the caregiver. So it can be hugely transformative for our practice, and it's really just, it's exciting to see what's going to happen. So those codes are implemented for Medicare Part B starting January 1st, and then the advocacy starts for getting those into private insurers. We also had a specific mention of occupational therapy as an important care team member for dementia care model in the new guide model that was from the Innovation Center, or what's sometimes known as CMMI. So this is a part of CMS, and they introduced a new kind of capitated care model to help address more of the long-term care required for individuals with dementia. And in their presentations and their slides, they specifically identify occupational therapy as a team member that would be important for this model. It's not very common that we see national recognition and acknowledgement of how OT is beneficial and how we can be supportive in community services. So this was actually a really big win. So OT is not required, but it's fantastic to see. We were the only provider besides like nurses, case managers, and physicians to be identified as a valuable part of the care team. Certified community behavioral health clinics were expanded nationwide. This was previously only in a few different states. It's now officially been expanded nationwide, and so states can now advocate to require coverage of occupational therapy in these settings. So it's different government funding for these centers. CMS approved the expansion of power seat elevation equipment. So that was a new coverage requirement that passed. It was very exciting, especially for those who are working in wheelchairs and equipment. There are new policies in all settings to allow coverage of lymphedema garments for Medicare patients as durable medical equipment. This has definitely shaken up some people's practices, and it's definitely a policy that there are still lots of issues with and things that we would like to do to make the lymphedema garment policy better. but it's still a really big win because if you've done lymphedema, then you know you'd provide all these interventions and then not be able to get them the compression garments, which kind of defeats the whole point of providing the interventions in the first place. They leave and you see them back in a few months because, of course, the lymphedema continues to get worse. So we're very excited. And let's see here, more wins. So there's confirmed coverage of telehealth in hospital-based outpatient clinics for therapy services under the Medicare physician fee schedule. Initially, CMS had a misunderstanding of how therapy is even paid for in hospitals. They thought it was under a different policy. So AOTA, APTA, and ASHA did a lot of advocacy work to educate them that we are reimbursed under the fee schedule for Medicare Part B for hospital-based outpatient clinics. And so we were able to get it clarified and verified from CMS that therapy is still covered by hospital-based outpatient clinics for telehealth. Telehealth coverage was extended until the end of calendar year 2024. So that means pretty much until January 1st of 2025. This was required by legislation that passed at the end of last year, but it was good to go ahead and see it reconfirmed in policy. What was a surprise was the inclusion of general supervision of OTAs and PTAs in private practice extended to the end of calendar year 2024. So this provision was part of the public health emergency and was initially supposed to end like in a week, but CMS decided to go ahead and extend it and is looking further into permanently repealing the direct supervision requirement for private practice. So that's something that we'll definitely be seeing in 2024, some more advocacy and action around. OT was included as a required covered benefit for intensive outpatient mental health services. So this is under Medicare. So there's already, I believe, intensive inpatient care. And this is the kind of a similar model, but for intensive outpatient services. And so if a patient needs occupational therapy, then it is required under this program that that facility provide it. I'll admit that's about the extent of my knowledge of the program. So if you have questions about this specific program, I encourage you to contact AOTA. But either way, it's always good when we see that occupational therapy is included as a required benefit, especially under mental health. It's just further evidence of the fact that we are qualified mental health providers. Some other wins, that AOTA member, Tracy Mirage, she testified on behalf of rural home health issues in front of Congress. So she went to Washington, D.C. and testified on behalf of occupational therapy and home health. And we had 6 new states enact the OT licensure compact, which brings us up to 28. So overall, so many great progress that we've seen in 2023. I think that's my last win slide. Yes, but this is even just a small section. This is what I pulled off from my advocacy updates that I've made and AOTA's advocacy updates. I'm sure there are countless others that I did not include here. And so it's just really, I think it's easy to feel like progress isn't happening or that we can't make a difference or that nothing will change. But hopefully just these couple of slides can show you that change is happening all the time and that it takes pressure, but it is possible. And it's possible because of people like you, of people who are engaged in these policies. So what have our legislative efforts been this year? Oops, not too far. So like I said, legislation has been kind of interesting for 2023 because of all the issues in Congress. The Occupational Therapy Mental Health Parity Act was officially reintroduced, and it was included as part of a legislative package that passed the Senate Finance Committee. So what that means is that this package is now eligible to be heard on the floor. So hopefully we will see it included in some sort of final package whenever that legislation passes, most likely sometime in January. We're also advocating for the funding for the Allied Health Workforce Diversity Grant Program. We created the Allied Health Workforce Diversity Program as part of legislation passing last year. Now we need money to fill it. So we are advocating for funding of that program. The Empower Act was introduced in order to replace the SMART Act. The Empower Act is addressing the OTA payment differential, as well as trying to permanently remove the direct supervision requirements for OTAs and PTAs. We have bills to expand permanent access to telehealth for therapy services. I didn't list any specific one here because there's quite a few. So, but the good news is there's lots of momentum around this issue. So hopefully we'll see progress. If I had to guess, it won't be until the end of 2024 when they're against a deadline. But hopefully we'll see something happen by then. I have a feeling that 2024 is going to involve a lot of healthcare legislation. We identified sponsors for the Medicare Home Health, that should say Accessibility Act. Apologies, not the Flexibility Act. That was the previous one. So we have identified sponsors for the Medicare Home Health Accessibility Act, and hopefully we'll see that introduced soon. That addresses issues with OTs being a qualifying service in home health. So if that bill were to pass, it would add OT as a qualifying service for Home Health Part A. We also have the Mental Health Professionals Workforce Shortage Loan Repayment Act. This one's fairly straightforward, but it includes OTs and loan forgiveness for who work in mental health. Unfortunately, it's not available to OTAs because you do have a minimum of a master's in order to be eligible for loan repayment as part of this program. But again, still really excited that we were included without us having to ask for it, so that we're already being considered as automatically as part of mental health providers. We also have calls for permanent reform to the Medicare physician fee schedule and for Part B regulations. This is going to get interesting, I think, next year. We'll see what's happening, and I talk a lot about it in the latest episode that I put out. So for some kind of wins, because there's always some things that are kind of okay, kind of good. Aetna is delaying the implementation of the OTA payment differential from December of 23 to March of 24. So obviously not good that they're implementing the OTA and PTA payment differential, but at least with pressure, we have been able, or AOTA and APTA have been able to delay it until March of 2024. So there is maybe some potential hope that we could repeal it altogether. Hard to say, but at least it was slightly delayed. So it's a kind of win. Multiple pieces of legislation to address the upcoming payment cut to Medicare Part B under the fee schedule. I get into quite a few of them in the latest podcast. But again, we most likely won't see action until January. So more like the kind of win is that people are interested in fixing it, but it's still probably going to go into effect. And it's hard to know if we'll end up with as significant of a cut, if less of a cut, if maybe a little increase. It's going to be hard to say. They have to pass legislation in January and February in order to address the budget. So most likely we'll see something included in there, but it's kind of one of those toss-up wins. Could be a win, could be a loss. Hard to say. All right. And that's it. That's my 2023 updates. And so thank you so much for being here. We're going to transition here in a couple minutes over to our Amplify OT membership Q&A after party, and also to talk more about some 2024 advocacy efforts. And Shannon, I saw that you're a CLT and you're excited, but yes, there are a lot of questions and issues around the lymphedema legislation policies and how exactly that's going to be executed, and something that I know AOTA has been frustrated by and advocating for. So it'll be really interesting to see how that goes in 2024. And yes, Kara Welke from Next Level OT has been very involved with the guide model and speaking with folks at CMMI and AOTA and making sure that, you know, occupational therapy is represented well. So that's it. Any questions or anything you guys want to share before I hop off and onto my other call? Thank you for being here, Shannon, even while on vacation and camping in your RV.
Dedication.
That's right.
It's really impressive, Clarice, really. I mean,
Thank
so
you.
many things, not just your own platform and business, but you know, your involvement in advocacy and keeping track of what's going on and what's coming. I think it's very impressive.
Thank you,
Yeah,
Gail.
I just wanted to tell you, thank you so much for like boiling all this stuff down. Because as a practitioner, it's like, it's just so hard. Like, I mean,
Yeah.
I've got students all the time, you know, I want to keep up with stuff. I split between acute care and outpatient, you know, obviously for my lymph patients. And it's, you know, you want to bill correctly. You want to get patients the most that you can for their insurance dollar. And, but there's just so much that changes all the time. So I just wanted to tell you, thank you for doing this. And I really appreciate the time that you put in as a practitioner. And then the resources you provide for your students too. Like, I didn't have this stuff in my program. Like, no one talked about the billing. So, so it's been sort of a ongoing process of trying to learn as I go. And I just really appreciate it so much. So thank you for doing it.
Yeah, I'm so glad that you find use in it, and that others have found use for Amplify OT and that it's grown to where it is. I mean, if you've heard me talk about it before, when I started it, I didn't intend for it to be a business. I really just wanted a place to write about policy in order to get a policy job, because I knew that I was young. I'd only had 3 years of experience at the time, so I knew that I needed to kind of prove myself a little extra to be able to get a job in policy. And then things fortunately fell together in a sense. And obviously there is some method to the madness. There is some strategy, but I'm just really glad that people are receptive to it and are willing to listen and to be here, because I wouldn't be able to do this without folks like you all showing up and following me on Instagram and responding, and definitely hearing comments and things like that are really what keep me going through it. Because otherwise I just kind of sit here by myself at the desk and hope that somebody's listening.
I think the numbers
yeah,
are very, very impressive numbers.
Thank you.
Oh yeah, totally. Yeah, they really are. So, and I appreciate you like just doing that, because it's always, I love that there's so many different people doing different things to help provide resources to practitioners. Like you've taken the time out to do that, because I just can't even say enough. Like, we work long hours to try and help our patients and take care of our patients, and we know we need to like learn about all of these things, but having the time to like gather the data and actually like process it and put it into use is just really a big challenge. So I can't even tell you enough like how much folks that like us in the trenches appreciate it, that aren't in academia, that don't present, so, and I'd love to be able to pass this stuff on to my students that that I have. So,
well, and Shannon, you're in 2 different settings, so you've got to keep up on inpatient and outpatient both. So it's like double.
Yeah, yeah, it is. So I can't even imagine doing home health or skilled nursing right now, because it's like all the regulations are just so different. How all of that is, and then with changes with the legislation after the I can't remember the name of it, but we used to be able to open Oasis for a little bit, and now we can, and that's a lot to just keep up with.
Yeah, there's always policies changing, and that's the hard part, is knowing when they changed, how they changed, and what it means. I found that a lot of times folks are really scared of what's happening, but without need, because they heard that something's changing, or someone told them that something's changing, and what's actually happening really isn't that bad, or it's only going to affect a very small number of people. And so, it's always good to hear that folks are feeling empowered and supported by the content.
Oh yeah, totally. And you see on all the different OT social media pages, people get real worked up about stuff, and it's like, are you working off information that's actually accurate? And like, go and find some information. Yeah, usually not. And so, I don't know. But it does take time and energy and effort, and even the people that do the billing don't always keep up.
Yeah.
So it's like you just have to, as a practitioner, like know what you're allowed to bill, know what the codes are that are going to get reimbursed, like do things accurately as best you can, and so that your patients don't get these crazy bills that are not covered by their insurance. And especially with the garments too, like that, being able to bill for the measurement or not bill for the measurement, and that's like a whole other thing that's just like, I'm so excited that the garments are covered, but there's a whole other can of worms involved with who can bill for those, and who can bill for measuring, and who can bill for obtaining. And so there's
Yeah, I talked to AOTA about it recently, because I was confused about one of the policies, and they were talking about the issues with that we can't like bill for the measurements. You're supposed to get that payment from like the provider, but that directly conflicts with a previous Office of Inspector General report that identified that as a kickback. So I know. So CMS's policy is almost directly going against its own laws regarding anti-kickback laws. So it's going to be really interesting to see how it plays out.
Yes, it totally will. And so, I'm like, I don't really know what to do in a couple of weeks, but we will do the best we can. And I mean,
that's all we can do.
Yeah. I mean, and hope that we don't get a whole bunch of stuff rejected, and, be like, okay, do the best we can and ask for forgiveness later is all you can sort of do.
Yeah. Well, and if they're telling you one thing and I don't even know. I don't know what to say about
Yeah.
it.
Okay.
It's
Well, that
definitely
makes me
confusing,
feel
and I learn
slightly
new
less-
things all the time.
Right. That makes me feel slightly less bad if you don't even know.
No. AOTA doesn't know. No one knows that they've said they pointed that out in their comment letter, like all the issues with it, and CMS is like, nah, they'll figure it out. So
Oh,
we'll see.
delightful.
Sometimes
Okay.
policy is really fun like that.
Yes, like clear as mud. Great. Awesome.
Exactly.
Well, again, thank you for all you do, and I'll let you get to your other meeting. I'm going to peace out and enjoy my fire and
Yeah.
keep on trying to do the best for my patients. That's all I can do.
Well, perfect. Thank you so much, Shannon and Brianna
Right.
and Gail. I'll see you in a minute.